Yes, because you have flooding and waterborne diseases. There's no other time they would come up if not during rainy season. And after heavy rainfalls and floods, clean water sources become contaminated, like I told us, because some of the pipes might be broken and we would not know. And this can lead to some form of diseases like cholera, where you are defecating, you are vomiting, causing dehydration. It could also cause typhoid fever. It can also cause diarrhea and other stomach infections. You know, people might unknowingly drink or use unsafe water when access to clean water is limited. We need to ensure that any water we are taking for our children or communities, that these waters are clean. Another important aspect, another important one might be, you know, stagnant water and malaria. We've always advised that stagnant water could breed female Anopheles mosquitoes. And so when you have female Anopheles mosquitoes breeding in your area, maybe in the stagnant waters around your environment, what this does to you is it has a way of breeding mosquitoes, thereby exposing you to high malaria. Because when the mosquitoes come into your house, definitely they will bite you. And when they bite you, come on, the next thing is for you to fall sick with malaria. Flooding often leaves stagnant water in streets, in our gutters, and even in our open spaces, which is not healthy for us. Again, this stagnant, some of us, because of the hot weather, we go to swim, which is absolutely fine. But these stagnant pools, as it were, might be breeding grounds for mosquitoes. That is why you step your foot into some pools and you find out that mosquitoes are floating all around you. It is not a water that flows off, it is a stagnant water. Yes. It also increases the risk of malaria, especially for pregnant women. Pregnant women, the elderly ones, children with reduced immunity due to disability or one health challenge or the other. And even the men, I mean, anybody can as well come under some of these things. Another one is the spread of illness. Even with the rainy season, we are still struggling with heat. That is the truth. Just as it's raining now, in the next 1 minute, this rain might just translate into heat. You see? And when we have this extreme heat, it contributes to poor health conditions because high temperatures can cause dehydration. We have spoken about this in our previous episodes where we talked about continuous dehydration, where you feel thirsty at intervals. And we have always made it clear that you need clean water. You need to ensure that even when you want to sleep at night, please keep a rubber of water beside you so that you will not feel tired to stand up from your bed to go and take a bottle of water to drink when you feel thirsty, even at night. I always ensure to keep a bottle of water beside me so that when I'm thirsty, I can just sip water. And heat exhaustion, you know, there's a way you will sweat, you will just feel like, oh, you are all exhausted, you are all drained mentally, physically, and otherwise. And this could lead to weak immune system. Yes, your immune system might be compromised because of the high temperatures. And this can also make your body more vulnerable to infections. It also speeds up the spoilage of food and contamination of water. That is where you see some people, they make food, maybe they forgot to pack it up and put it in the freezer or what have you. And you find out that before morning your food gets bad because the heat is affecting everything, including our food. And you know the high cost of buying foodstuffs in our markets now. And for our families and communities, disease outbreaks affects families in many ways than we can even imagine. Because, I mean, one, you already have a budget. When you fall sick suddenly, it means increased medical expenses. Sometimes these medical expenses might land us on admission in the hospitals. So we have to be very, very intentional. It leads to loss of income due to illness. Of course, when you pay medical bills, what next? You might say, oh, I have NHMIS, but then it is limited. Your sickness might not be limited in what can come with it, but your NHMIS, because I am under one, I know that it is limited. And sometimes you might be left at the mercy of your own pocket. And you know what the situation in our country is saying. We also look at children missing school. When it's poor, we have heavy downpour, children might likely not be able to go to schools. Yes, because umbrellas will not even serve. For some of the climate issues we are talking about, umbrellas will not serve us at all. And then we also look at the strain on the already limited healthcare system. Our healthcare systems are actually struggling, as it were. So when you now have this added influx of people, whether you are going to the primary healthcare facility, the secondary healthcare facility, or what have you, we are already straining an already strained healthcare system. So you see that climate care, directly or indirectly, is affecting different aspects of our health system. If you are just joining in, the program is still Climate Care on radio on WFM 91.7, Women FM, and today we are looking at an important topic, which is climate change and disease outbreaks. Last week we talked about flooding, and this week we want to look at how this flooding affects us, why it causes people to be sick, because it affects us. If you want to be a part of the program, do well to dial our phone lines on 0700 0917 917, 09155 917 917. And wherever you might be, you can watch us on the go. You can go on our YouTube at WFM 917. You can watch us on all our social media handles at www.wfm917.com. And so as we continue, the time is 11:44 a.m. That is 16 minutes before 12 noon. And today is the 6th of June, 2026. And we are looking at how climate care affects us as a people. Now, for low-income households and persons who are elderly, persons with disabilities, they are often most affected, including our women and children, due to limited access to health care and safe water. I am a woman with disability. Imagine if I can't leave my house to access health care. Imagine if I can't leave my house to access clean water. It automatically means that I struggle with every other thing. Now, imagine those who are elderly. Imagine women with, 4, 3, 4, 5 children. How do they cope in our communities? So for us, we don't only look at the problems, we also look at solutions. That is why we bring this program to you. So for prevention and community action, what are the things we need to do to risk disease outbreaks? What are the actions we can take? The simple actions. I'm not asking us to go and call the government or to do something that is beyond us. No. What are the simple actions we can take to curb climate change as it affects us? One, we need to drink and use clean water. Please ensure to drink clean water. It is better you invest in portable clean water than you spending that money in the hospital. Trust me, you would not like the outcome of you going to hospitals. It is better you look for treated water to drink. Please and please ensure that you teach your children your words, the people who live within you and your communities. Ensure that they understand proper hand washing with soap and clean water. It is not too much. Once you are coming into your house, please, you have touched Naira notes, you have touched different things. You don't know how many people have touched these things. So the most important thing you do is use soap and clean water to wash your hands first before you begin to hug your children and do whatever you need to do. Please, it is part of the ways we help ourselves. It is also important that while we work on weekdays, can we pick a day, say weekend, to ensure that our drainage systems are clean? We need to ensure that we clean up our drainage systems to prevent stagnant water. Yes, so that we do not have stagnant water in our gutters, in our walkways, and what have you. This is very important. We have always spoken about proper waste disposal on the show Climate Care. It cannot be overemphasized to ensure that we dispose our waste properly. Don't just dump it by the roadside, Kokomi, or it's not my business, or you say, oh no, Shebi, I live in an estate, and I live in an estate. And for one day, I have a waste bin in my house, and for every time I need to dispose it, I tie it up and put it in the central waste bin that is within the estate. If you don't have that, if you don't live in an estate, it is not a bad thing. Ensure to dispose your waste at the appropriate place. Please, if you can, use mosquito nets and NAFDAC approved mosquito repellents, because so many people are making so many things and you don't just want to go and use any kind of thing. Ensure to use a proper mosquito repellent, very, very important, and a mosquito net whenever you have the opportunity. And remember, you don't just buy mosquito nets and start using it. Ensure that you are sun it or you wash it to reduce the strength of the chemicals that is used for it. It's also important that we seek early medical care when symptoms appear. In Nigeria, we have one problem, and that is everybody is growing up in a Nigerian home. You know, one of the things I noticed was that my mom always has every drawer. All sicknesses are not the same. And so the fact that the symptoms might be similar does not mean, and hey, Nigerians, you say, the English proverb says a stitch in time saves 9. So it is important that we seek early medical care when symptoms appear. Don't just assume and say, oh, don't worry, Jare, it happened to Mama Shukura. Let me just go and collect the drug they use, the name of the drug, and go and buy. No two similar symptoms are the same. Our genetic makeup are not the same. Nigerians, we need to come to terms with reducing our level of self-medication. We are good in that. Let us reduce self-medication, please. Very, very important. And it's also important that the government and community are also part of this process, you know, in ensuring access to clean water. We call on all governments to ensure that the basic things that each community needs is provided for them. At least clean water, sanitation, and even healthcare services. Do you know what it means for you not to be in good shape? With everything that is happening in Nigeria, you would not be able to cope. That is the truth. So at least government should ensure that our citizens have all of this. And as a community, the ones we can do for ourselves, because I mean, there's need for collaboration and partnership. If you have people who are doing well within the community who can support some of these projects, please ensure that you share these ideas with them to ensure that we do what we need to do to ensure that our communities have the basics: clean water, sanitation, living in a clean environment, and having the appropriate healthcare service that we need. As always on Climate Care, we will always tell you that climate change is not only about our environment. It is a public health issue. It is a global issue. It is not only happening in Nigeria, but here on Women Radio, we try to bring these things, we try to keep citizens abreast of the happenings so that we do not get caught up, suddenly when we are not even proactive about the things that are happening. Again, floods and extreme heat do not end when the water dries. We need to know this. It doesn't end when the water dries or when the temperatures drop, please. They often leave behind health challenges, that affect our families and affect our communities, which is why we keep talking about us being very, very intentional about our health. Because a living dog, no matter the situation in the country, a living dog is better than a dead lion. And so our message is clear. Preventing disease outbreaks is part of adapting to climate change. This is a message to every family, to everyone who is listening or who might watch us later. When we protect our environment, we also protect our health. You are not doing it for your neighbor, you are just doing it for yourself. And by extension, you are extending the same grace to your neighbor. And it's also important that we understand that our environment is a huge part of who we are. As we go out, as we come in every day, your environment needs to be protected, because no matter what you face outside, when you come in, you are coming in to your safe heaven, your safe space every other day. And so I want to say thank you for listening to Climate Care on Women Radio, WFM 91.7. I want to say a very big thank you to my executive producer, Toun Shonaya Okewale, for the opportunity. I am Susan Iwoma. Stay informed, stay responsible, and remain climate conscious. Just as you go for your weekend, don't just party and not dispose your waste as it should. Thank you for having me. See you same time next week on the show Climate Care. Thanks and have an amazing weekend. Bye.